Are you wondering what a discovery visit is? If you've been hanging around in our world for a while, or you've seen our website, or maybe you've noticed on our YouTube links that we talk about this thing called a discovery visit, which you probably have never heard of before and you've been wondering what it is. Well, today's video is for you. We are going to be discussing who the discovery visit is for, what will be included in that visit, and what your expectations can be for the end of that visit. Ready? Here we go. Our discovery visit is a free 20-minute consultation, and it's an opportunity to sit down with one of our specialist physical therapists and discuss what's going on with you. So we want to hear your entire story from beginning to end and all the things in between of what's been going on and what's brought you to this point in life. Usually people who come and see us have gotten very frustrated with the medical system as it is currently, with dealing with their pain, with their limitations on their life, and they are looking for answers and they want to know what's going on with them. So we created this discovery visit to have an opportunity to sit down and listen to you and your story and ensure that you are a good fit for what we offer here. And what we guarantee is if at the end of the discovery visit, we do not agree that we're the best fit for you, or you don't feel that you're the best fit for us, then we will do our best to try to help you find the next best step for you in your health journey. We understand that it is super frustrating right now trying to navigate the healthcare system and who do I need to talk to and what do I need to do and how, when, why, all of those things. So we're here to help guide you on that journey and help you find your next best step. Now, more specifically, who is a discovery visit for? The discovery visit is really designed for people who have been let down by other healthcare providers, or who have not felt like their entire story is heard, so they don't feel like they're being given good direction. Because when you don't get a chance to really explain what's been happening, it's really hard to know what the next best step is. Many of our patients who come in for those discovery visits are very skeptical because they've been let down by other providers, they haven't gotten the results that they were looking for, they don't feel like they've been listened to, and they really just feel, honestly, like nobody can help them anymore. Like nobody understands, like nobody is ever listened to their story and their journey. And I remember one particular patient who came in for a discovery visit, and she had been in a horrific car accident. She was in the ICU for 4 days. I mean, it was horrific. So she went through a ton of rehab, obviously, I mean, ICU and the rehab hospital. I mean, she did all the things. A year later, she went in to see her doctor, and her doctor said, great, well, everything's healed up and you're perfect, so have a great life. And she said, but I still have pain and I can't walk or pick up my grandchild or kayak, so I'm not done yet. And he's like, yes, you are. You're done. And you can imagine how frustrating she was. Now, walking, picking up her grandchildren, and kayaking were things she could do the day before the accident. So these are all very reasonable expectations for her to be able to achieve after the accident. She was so frustrated, she was crying. Have you ever been to that point of being so frustrated that you are crying because you're so angry and emotional and upset and you just feel like nobody's listened to your entire journey? So after listening to her journey and handing her some tissues, of course, I said, I'm so sorry that this has happened to you. I can already pretty much tell you what's going on and what we need to do. Now, we need to do a full evaluation so I can confirm my results, because I don't want to treat something if I don't know that it's exactly what needs to be treated. But this is all treatable, and you definitely should be able to get back to picking up your grandchildren and walking and being in the kayak without having any problems. And friends, I'm here to tell you, she was able to get back to all of those things, and it was so awesome to see her really just blossom as she came out to who she was created to be, because she was stuck in kind of this prison, is the best word I can say, of pain and fear and frustration and anger. And she was able to move through that in her body, in her mind, and her soul, so that she could enjoy her life again and get back to walking and playing with her grandkids and not being worried about what she could or couldn't do on a daily basis. It was such a fantastic journey, and it was so fun to walk with her during that time and see her get back to doing all the things that she loved to do pain-free. So if that sounds like you, and you have just been frustrated by a system that is not listening to you, that is not hearing what you're saying, and you are just beyond frustrated, then this discovery visit is for you, because we will listen to your journey and we will see if we are the best fit for you. And if we feel we're not, I guarantee you we will do our best to figure out who it is that is the next best fit for you, and we'll try to make a direct referral if possible. If not, we can definitely start giving you some ideas on who you need to be looking for. So what is a discovery visit? Well, really a discovery visit is a sit down and chat. We won't do any testing. We won't ask you to do anything that's painful or anything like that. Really, we want to sit down and talk and hear your story. Now, along the way, we'll ask you to point to the painful areas, because you may be like, oh, I have pain in my neck. And we're like, okay, well, where in your neck? But we're not going to ask you to do the thing that's painful, because that doesn't do any good, right? But we'll talk about what are the activities that are painful. When do you notice this problem? What does make it worse? What does make it better? And we also really want to know what you've tried before. It's really important to understand if what we do here is going to benefit you based on what you've tried before. So if you've tried something that's very similar to what we do, a manual physical therapy approach, with a very specific exercise progression, then obviously you're probably not a good fit here unless I can find some other thing going on, which I did have one patient that was the case. She had done well with actually one of my colleagues who I went to school with, but she needed a little extra that was particularly in my wheelhouse. And so combining what she already had with what I had to offer, she was able to get the results that she was looking for. But I knew that based on having that discussion of what she had already done and what it was that I needed to bring to the table to get her over the top. So what it comes down to is the discovery visit is really going to be a conversation. We will sit and talk. We can stand if sitting is a problem for you. And we really want to hear about your journey and what's been going on with your problem. Now, at the end of the discovery visit, if we feel you are a good fit for what we offer here at Physical Therapy for Everybody, you'll be given an invitation to continue on to the full evaluation. And we're going to include the link to a video here that describes more about what that full evaluation looks like and how it's different than a more traditional physical therapy approach. And it's important that you understand you'll be given the opportunity if you are a good fit, and you get to decide if you want to continue moving forward, because that's part of the discovery visit too, is that you get a chance to come in, see the clinic, meet us in person, and see if it feels like a comfortable place for your healing. If you don't feel comfortable with our specialist, if you don't feel comfortable in our clinic, it is going to be hard for you to get the healing you're looking for. I understand that it's really, really a vulnerable place when you are in pain and you're entrusting someone with your care and with your body, and they're going to put their hands on you, not during the discovery visit, no hands during the discovery visit, but during the evaluation and treatment we are. And I understand that that's extremely vulnerable. So we need to make sure that you feel comfortable and you feel safe so that you can get the results that you're looking for. Really, we offer this free discovery visit to help you be able to have an opportunity to make the best decision for your health. We want to make sure that we've done everything on our end to make sure we're a good fit for you. And we want to make sure that you've had a chance to experience what we offer here. At least sight, sound, smell, all of that stuff. Now again, we're not going to put our hands on you or anything like that during this time. We want it to be very non-confrontational. It's a no obligation appointment, and you get to decide at the end what next steps look like for you. So, what kind of questions will you need to answer at the discovery visit? In order to determine if you're a good fit for what we offer here, we want to hear more about what's been going on with you. How long have you suffered? What's the pattern been? Has it gotten worse, better? Has this been going on for 30 years, 40 years? What have you tried already? Ice, heat, PT, acupuncture, chiropractic, all of those things. And how did they work for you? Again, we want to judge to see if we are a good fit for what you are looking for, so we need to understand how those other things impacted you. And before we finish, we really need to determine what are your goals for treatment. So what does success look like for you? What do you want to be able to get back to, or how will you know that you're successful? And a lot of people initially, this is a hard question, because initially people say, well, you get rid of the pain. I understand that, but if we get rid of the pain, what would you be able to do? Would you be able to walk? Would you be able to bike? Would you be able to run? Would you be able to hike? Would you be able to pick up your grandchildren? Would you be able to make dinner? All of these things are worthy goals, but how would you know that you were pain-free and you could get back to doing the things you want to do? Because that's the whole point. It's not about increasing your motion or increasing your strength. Yes, we may need to work on those things, but it doesn't matter if it doesn't get you back to the thing that you want to be able to do in your life, or usually things, because there's usually more than one. And the easiest one to meet will become your short-term goal, and the more challenging one to meet will become the long-term goal. But all of our goals are focused on what it is that you want, because we want to be really clear on where we're headed and how everything we're doing is impacting you to get you to that goal. Now, what should you wear to the DV? With the discovery visit, again, it's just going to be a conversation, so whatever you feel comfortable in is absolutely fine. We have some people who come in super dressed up. We have most people who come in just, comfortable clothes. But really, we want you to be comfortable. So whatever it is that makes you feel comfortable, able to have a conversation, that's what we want you to wear. Again, we're not going to put our hands on you. We're not going to ask you to do any movements or anything like that. It's just a conversation during the discovery visit. So whatever you happen to be in or feel comfortable in, feel free to wear that. Now, why do we offer that free discovery visit? A lot of people that we work with have been let down by other providers, and they are hopeless, and they feel like nobody can help them because nobody has listened to their whole entire story and seen how it's all connected. Many of our patients understand that although they have pain in one area, it could be coming from somewhere else, or there could be a contributing factor. A lot of them have already kind of figured out, this problem started a long time ago. It just looked a lot different at that time because things change as we age. And so they're looking for someone to help them put the pieces of the puzzle together because they know it's bigger than the current pain that they're experiencing. So a lot of our patients have already started to figure this out on their own, and they really appreciate that confirmation that we get here because one of our favorite sayings is everything is connected, and it's true. Everything in your body is connected. And so they really appreciate having someone who wants to hear about their ankle pain in regards to their low back pain, because chances are that those two things are connected. One of them probably caused the other one, and they know that already, and it's really helpful to have someone actually honor that and acknowledge that, and the fact that you've got to treat the ankle in order to get the low back pain to go away. So we created this free discovery visit to have a chance to put people's mind at ease that we will listen to you, and it's not just at the discovery visit, it's all the way through the treatment session. What you're saying will be honored at all points during treatment. It's not just the discovery session. And we will listen to what your body is telling us, because the next step would be to do an evaluation. And that's when your body's really going to have an opportunity to talk to us and tell us what's been going on with it. And from that, we'll have the goals from the discovery visit so we know where we're headed. So with the evaluation, we find out where we are. With the discovery visit, we find out where we're headed. And then we just create the path along the way to get you there. Now, what are your questions about the discovery visit? Did I get everything in here? If not, please drop a link below. I'd be happy to make another video for you and tell you more about our discovery visit, why we offer it, what's included. And now I encourage you to go watch this video over here to learn more about our evaluation. Have a great day, everyone. Bye.